Hello, my name is Jose Castillo, so I'm going to be validating for IV push. The first thing we do is we verify the order. So we go into the patient record and we see that the doctor has ordered ondansetron for the patient. We assess for procedure need, and we realize that this patient has been losing fluid and they actually need a drug like ondansetron, which helps with vomiting and diarrhea. So what we do is we go into the patient's room, we do hand hygiene, we wash our hands, and then we don gloves. We do have to apply principles of aseptic practice for this kind of procedure, so we do so. We provide the patient privacy, we make sure he's fine, and then what we do is we identify the patient, and how we do that is we go into the patient's wrist. He must have a wristband, and we ask the patient his name and date of birth, and we confirm. We explain to the patient what we're going to do, so we say we're going to perform an IV push. We're going to be giving you a medication called ondansetron, which is going to help you with your vomiting and diarrhea. Then we make sure the patient is safe. We make sure the bed rails are up, that the wheels are locked, and that everything is fine. So the first thing we do is we access the MAR, and we perform the check for the medication. So we do confirm that the patient is going to be using, that the doctor has ordered ondansetron. We stated before that this kind of medication is for nausea and vomiting. The doctor's order says 2 milligrams IV every 4 hours. And if we check the ondansetron bottle, which I have right here, and we do all the numbers and the calculations, we know that we would have to be giving the patient 1 ml. Performing the medication label check, we're gonna get, this is the first check we do, so what we're gonna do is we get the bottle again and we check that this is ondansetron. We make sure that the liquid looks good and clear and the expiration is fine, so it works. This medication is ready to be given. We have to use a syringe size that has at least, it could be, this in this case is a 10 ml, but what we need is 1 ml, so this actually will work for us. We have to, I already have inspected the medication for color, clarity, and expiration date. I already did the calculation, but I'll repeat it. It was, the doctor's order was 2 milligrams IV every 4 hours. And that will be 1 ml that has to be given to the patient. Then the next thing we do is we open the vial and we clean with the alcohol the top part. Then we need to, as we did before, we need to add 1 ml air. And what we do is we invert and we take, 1 ml. It should be right there. So we can see it right here. I don't know if it's clear enough, but that's 1 ml. And we'll cover the needle with a safety device. Then we're gonna perform the medication label check number 2. So we're gonna make sure that this is the right medication for the patient, and this is ondansetron, which is given by the order by the doctor, 1 ml, and the expiration date is fine. Then we go into the patient's room. We again wash our hands, we don gloves, and we access MAR at bedside. We identify the patient, so again we go to the patient's wrist. We make sure that the patient can give us his name and his date of birth. We perform the medications checks and write off a medication administration. Then we cleanse the injection port, which is right here. So that's the next thing that we do. And we confirm for patency. We gently flush. We have another, have a different kind. We're gonna pretend that this is a different injection. So we're gonna flush with normal saline, which is what we do right before we push anything into a patient. We inspect the site for any kind of occlusion, for any signs of redness. We see that the site looks good, everything is fine. We are waiting also for the port to dry while we do this. Now that we know that it's fine, we can inject the 1 ml that we had before on ondansetron into the patient. And we go really slowly. And we do it. Immediately after that, we dispose into the sharps container. We dispose of the syringe. We cleanse the injection port again. And we flush again with normal saline. And then what we have to do is we got to document per facility policy. So we have to say which kind of drug we use. So we, in this case, we used ondansetron. The dose was 1 ml per doctor's orders. The route is IV. The date and time is going to be September 29 at 6 p.m. My initials would be JAC. The patient's response to the treatment was good. The patient did not show any signs of allergies or nothing like that. There's no redness, no swelling in the area. The appearance of the IV site is good. Everything looks good. The skin is still warm. Everything looks the same as before we applied the medication, during and after